With the rising cost of healthcare and the increases families are paying for health insurance, it might be tough for families to want to even schedule a doctor's appointment. The key to that could be staying out of the doctor's office, as diet and exercise combine to help us live healthier lives. To learn more about how we can make our lives better by personal choices we make at the grocery store and fitting in exercise into our routine, we are now joined by Karen Howard. She is the director of the Organic and Natural Health Association. Karen, thank you so much for joining us today from Washington, D.C.
It's a pleasure to be here.
Can you first explain what is your background?
I came here a long time ago as a congressional staffer for a committee called the Post Office and Civil Service Committee, which has been rearranged and renamed several times since then, and I never left. So I've been in healthcare policy all these years.
Can you explain about the association that you are CEO of? What is its mission?
So we're the Organic and Natural Health Association. And what that means for us is that we represent the entirety of the dietary supplement chain, everything from raw ingredients all the way to the finished products. So that includes the manufacturer. And then the consumer organizations that promote and support dietary supplements, and groups of individuals are come along and through our education campaign. So we really do have a commitment to the integrity of what goes into the marketplace and the education of consumers to be able to utilize these products successfully.
Why is this important?
I think it's important because it's a very key component to how to live a good, healthy life, and that we've always relied on food for that. And dietary supplements are regulated as food, the second most regulated of foods. And that is a really key indicator that, we need these supplements because our food supply chain has kind of stripped out nutrients from what we eat. Even if we're eating all organic and doing it the right way, if you measure your levels, you'll find that I think it's 90% of people who are deficient in vitamin D, 98% of people are deficient in their levels of omega-3 that you get from fish, and anywhere from 50 to 80% of Americans are deficient in magnesium. So that's going to have a long-term impact on your health.
Can you explain for our audience what is organic? There is some confusion over what that term means.
There is some confusion on it, and organic is an actual term and art that has been defined by Congress. So agricultural practices are specifically used that fall into the organic category. You're not allowed to use the pesticides that make us sick, and you are required to have certain inputs into the soil. And the whole goal of organic is to be able to regenerate the soil so you don't need to put all the amendments in that go into conventional agriculture. So they're not spraying crops to get rid of bugs. And, when people have their own home gardens, which I'm sure you guys do a lot of where you are, you don't use the kinds of contaminants and pesticides that the conventional food producers use. So that's why it has its own logo. It's USDA organic, it's brown and it's round and it has USDA on the bottom. And that's a really good start to just begin to select foods and supplements who have declared themselves organic and meet that standard.
Can you walk us through why these supplements are so important? And we also know they tend to be expensive. And explain how one can balance that in their purchases, that they're going to spend more on supplements in order to improve their health.
Well, you can eat your way to good levels if you can figure it out, except for vitamin D. And people are very cautious about being out in the sun, and it needs to be in the middle of the day. So vitamin D is a great way to start because it's not expensive and it's pretty consistent in quality across the marketplace. Without vitamin D, your health hazards are so high, whether it's just hypertension, whether you're having a baby, like 40 to 60% of preterm births can be completely eliminated if you have the right vitamin D level. So that tells you the importance of what it means. Like, it's important for you to drink water. It's important for you to take vitamin D. It's important for you to eat the right foods. And if you want a good omega level, that means you've got to eat a lot of cold water fish that not a lot of people like. And without those omega-3 levels, you're doing things like damaging your eye health. I mean, it compounds itself. Magnesium, people have a hard time sleeping. We all need to be able to get good sleep right now to maintain health. And magnesium is one of the secret sauce ingredients that will help you do that. Just be careful about what kind of magnesium. It gets complicated. Lots of women take magnesium citrate, which is great for bowel movements, does nothing for any other component of your health. My favorite is L-theanate. Complicated, I know.
How can any of these supplements help keep us out of having to go to the doctor's office?
I can speak from personal experience that if you build your immune system with especially these three, you're going to have fewer colds and fewer incidents of just being sick overall. And I can say that the one time I did get COVID, I had no symptoms whatsoever. I was just kind of bouncing around, taking advantage of the fact that didn't have to go anywhere. So I think that there is a real innate ability to build that in with a healthy lifestyle, which includes eating the right foods, getting the exercise, and consuming the water that's correct and right for you, that it makes all this sense to compound these things together, and it will change your lifestyle, but it is a commitment that people have to really embrace as part of whatever else that they embrace for their health.
Education, so important. Thank you so much today for sharing this with us, Karen.
It's my pleasure. Thank you.